It is with great pleasure that I welcome to the conference Minister Poots, the Minister for Health and Social Services and Public Safety. This is a very important conference for ward sisters, charge nurses and team leaders, and the Minister has supported the conference since his appointment in 2011, and we are delighted that he's taken the time today out of a very busy schedule to be with us. So without further ado, I welcome Minister Poots to come to the stage.
Thank you very much, Dennis, and it is a pleasure to be here this morning to speak at the Ward Sister Charge Nurse Annual Conference. And we've had a busy enough morning. We've had 4 media interviews so far, and a few more to do as the day goes on. And of course we've another event taking place with the College of Emergency Medicine Summit, which is important to all of us, and we need to be identifying solutions. But of course I know that many of the solutions that we will be identifying, and nursing will be represented at that, will be identified by the colleagues in nursing. Often, and something I'll be stressing at a later point, oftentimes we actually know the solutions, but we've struggled to get them implemented. And I think that is fundamentally important to us today as we look at these things, that it is not just about identifying how we could do things better, it's identifying how we are going to do things better and how we actually implement them on the ground. And sometimes whenever we are doing innovation, and whenever I go to the Nurse of the Year event, and you see many of the innovative things that are happening, we need to be really encouraging people to be innovative, and whenever they have those ideas, to come forward with those ideas. And if it means giving someone a little time to actually develop those ideas, and time out of their current busy schedule to develop those ideas, for hospitals and trusts to ensure that they have the time to do those innovations, absolutely critically important. Because if we stand still, we will fail the public, we will fail the people that we're providing care for. We always need to be identifying new and better ways forward, so that we can meet the challenges that face us. And the challenges are growing, become more complex. As we pull off one success, we generally create a whole list of other problems, and that's a consequence of success. And we have many, many older people living in our population. That is something to celebrate. It's great having our population living older. We want to give them more healthy years. And we want to ensure that when they come to the health service for treatment, that they get treated, or that they are treated with absolute dignity. And that is something which is, critical to all of us, that we provide that dignified care for our elderly population. And I know that as nurses, that is something that is in your psyche, it's in your makeup, and it's something that you will want to do every time. And when it doesn't happen, it is something that hurts. So, I was taking note of the themes for your conference today: leading care, leading teams, innovating and supporting person-centred care. And those can all be hard things to do, and especially when you're under pressures as you currently face. And all of you here today don't need to listen to the news or read the papers to know about the very real challenges that exist in leading care and leading teams, and innovating and supporting person-centred care. I know that every day you face those challenges, and indeed you meet those challenges, and I just want you to know that for me, many members of the public contact me directly, through telephone, through meeting me, and through letters, to say, we got a great service, would you pass on our thanks for the care that we received? And you don't hear about it on the media. I get it all of the time. And indeed, I can't walk down a street without someone coming over and saying, just want to let you know, I was in the following hospital and I received excellent care. The staff were brilliant, and that is something that people need to be aware of. So thank you very much for the work that you do, for the courage that you show in the face of what is an unrelenting pressure, and for the can-do attitude. And we do recognise the great job that is done in our hospitals by our nursing staff. I've seen it firsthand, the difference that you make to patient client lives, whether that be in an emergency department, in an ordinary ward, in a patient's own home, in nursing homes, in hospices, or rapid response teams. I could go on. That's the thing about nursing, it's a 24/7 day service. And the difference that you make to people's lives is something to be proud of. I believe that the ward sister, the community district sister, the nursing team leader is the boss in their ward, in the department, and indeed in the locality. You are in charge, and you do set the standard of care. And your job is important. It's a job that takes time. It's a job that deserves time. That is why, under delivering care, I've just approved a move towards making the ward sister 100% supervisory in order to fulfil ward leadership responsibilities, supervise clinical care, oversee and maintain nursing care standards, teach practice and procedures, to be a role model for a good professional practice and behaviours, oversee the ward environment, and assume high visibility as nurse leader for the ward. The Chief Nursing Officer has focused on what the supervisory status will mean for you as individuals, and how she hopes it will strengthen safety, quality and experience for the patient. And I just want to reiterate those expectations. For now, the Delivering Care project just focuses on medicine and surgery. However, the next phases are underway, looking at emergency departments, district nursing and health visiting, with further phases for other areas planned. At this time when the health system is under considerable pressure, it is crucial to have strong clinical leaders like all of you at the side of the patient, and you are their strongest advocate. The Nursing and Midwifery Council, the directors of nursing in each of your areas, the Chief Nursing Officer and myself rely on you to provide assurances on safety and quality. More importantly, patients and their families rely on you. They trust you. Don't trust me, by the way, but they trust you. And they expect you to act as their advocates on their behalf. As the leaders closest to the patient, it is you and your team that provide continuity of care. You deliver the 24-hour service that links together all aspects of the patient's experience. When you have concerns, I want you to be confident in raising them through the appropriate channels and having the appropriate response when you do raise them. That might be a problem, but we want that to be the case. I want to take this opportunity to assure you that any concerns raised by you will be taken seriously, will be investigated, and actions will be taken where necessary, and we need to ensure that that's the case, that management are not dismissive of nurses whenever they raise issues of serious concern, especially when it involves patient safety. As Minister of Health for Northern Ireland, I'm not only committed to ensuring high levels of quality and safety in our health and social care services, but I am committed to equipping staff to work in safe and well-equipped facilities and to be well supported in the community. We need to work as a team and focus on what is best for the patient. You are the people who know best, and you have the solutions. At the unscheduled and emergency care summit today, some of your colleagues are investigating how best to maximise the effectiveness of urgent care here in Northern Ireland, and it isn't just a Northern Ireland issue, by the way. They're hoping to identify best practice and successful strategies to build greater capacity and resilience across unscheduled care. I have no doubt that all of you here will ably rise to the challenge of the actions agreed at the summit. I'm heartened today when I look at your programme and I see words like resilience, change, transforming, reforming, breaking barriers, driving standards, person-centred and innovation. This is the type of attitude we need. This next year will be challenging for those working to deliver health and social care services. As we move forward with the implementation of transforming your care, if we are to have safe, resilient, high quality and sustainable health and social care services for future generations, and I don't think that that's an issue that we can have any doubts about. That is just a must do. Then transformation is going to be a necessary element of that. I don't think any of you will disagree that that's the case. Our health and social care system is already under massive pressure, and if we do nothing, our system will not be able to provide the high quality and safe services which we all want to see for all of the people of Northern Ireland. In taking forward the transformational work under TYC, it is vital that the quality and safety of services is not compromised. I remain strongly committed to the principle of protecting and improving the quality and safety of health and social care services. Patient and client safety, as a key component of that quality, has been and continues to be a priority for us all. I'm moving forward with transformational change. I'm delighted to have secured the required funding in 2014-15 to commence work on the new regional children's hospital at a cost of some £250 million. My department has also recently published its consultation document setting out proposals for a forward strategy for the next 10 years for paediatric health services in hospitals and in the community. The current facilities in some places are nearly 100 years old, and the new hospital, which is expected to be completed in 2021, will ensure that children will receive their care and treatment in a modern paediatric environment. In the primary care sector, we're seeing the progression of new healthcare hubs in Banbridge, Ballymena, Newry, Lisburn, Homa. They will complement existing health and care centres and will provide a range of smaller spokes, thus allowing some services previously only available in hospitals to be delivered in community settings. I'm also pleased to endorse the reform in mental health and learning disability services in line with the Bamford vision, and have seen the switch of money, which was around 60% hospital, 40% community, going to 56% community, 44% hospital. It's a demonstration that has been done in mental health and there's still more to do, but it's also a demonstration that we can take more from hospitals and do more in communities. And I've been pressing your Chief Nursing Officer about additional training for specialist nursing, and I think that there are massive opportunities that exist out there for specialist nurses across a whole range of fields, that our trusts need to ensure that the time is given to nurses to actually engage in that training, and I know that there's a cost associated to the trusts, but it's absolutely essential that they do it, and also that we continue to work up more emergency nurse practitioners and advanced emergency nurse practitioners to ensure that we can rise to the challenge in our emergency departments. But we will see less demand for inpatient treatment as we continue to enhance our early interventions through community teams and community facilities such as Old Sea House. And in social care, we see a structured regional approach on the way forward for engaging, consulting and implementing changes to the provision of statutory residential care homes across Northern Ireland. Criteria for the evaluation of statutory residential homes have been developed and are being consulted on. I've given you a flavour of some of the examples of transformation happening across the health and social care organisations. An important thing that we must do is to build momentum and maintain momentum, to ensure that carefully planned changes are visible to the public and to the workforce. I believe that we can look to a future with renewed confidence, and by working together we can make a real difference that everyone wants to see. We face huge challenges, but we also have an exciting agenda. Our new services will see significant improvements in efficiency and performance. Quality and standards will be driven up without compromise. All of you have been involved in dramatic changes over the course of the previous number of years. And if many of you would wind the clock back, some of you can go back a little further than others. Some of you can go back over 10 years, some of you can maybe go back 30 years, but nonetheless, if you all wind the clock back to some of the practices that you had when you started, and you look at the practices that you actually carry out now,
you have made dramatic improvements. But we haven't finished, we never will have finished. There are so many opportunities to continue to drive that change. And it's not a change for the sake of change, it's change to actually make improvements and make things better for everyone. I know that our patients are in the best hands possible because you care about them. And I know that the can-do attitudes will deliver the transformation we all want to see. But most importantly, you will ensure that during the period of change, that you won't compromise or indeed allow others to compromise on safety, quality, or the patient experience. And that's absolutely essential that you do that. So I want to wish you well for today's conference. I hope that it's an enjoyable day, that you catch up with some people that you haven't seen for maybe some time, that you have a minute or two to recharge your batteries, and that you go back to wherever it is that you're working with the confidence that you do have support and that you do have a listening ear when it comes to issues related to the services that you provide. Thank you very much.